Today, let's discuss the health-related physical fitness. Regular exercise is one of the best things you can do for your health. It has many benefits, including improving your overall health and fitness, and reducing your risk for many chronic diseases. There are many different types of exercises. It is important that you pick the right types for you. Most people benefit from a combination of different kinds of exercises. Physical fitness is crucial for well-being and active life. The total progress of an individual should be prioritized in terms of the physical, mental, emotional, social aspects, and health through a comprehensive physical fitness program and assessment. As students, you can only perform at the height of your performance when you are healthy and strong. Thus, you need to be actively engaged in lifelong habits of regular physical activities for your overall health improvement and quality of life. The physical fitness test, or PFT, is important because it is a set of measures designed to determine a learner's level of physical fitness. It is intended to test two categories of physical fitness, which is commonly referred to as health-related and skill-related physical fitness. Health-related components refers to those physical attributes which enable a person to cope with the requirements of the daily living, such as cardiovascular endurance or stamina, muscular strength and endurance, flexibility, and the appropriate body mass index or BMI. Health-related physical fitness are important to improve the overall health of an individual. Health-related fitness or exercises helps to develop and enhance body composition, flexibility, muscular endurance, muscular strength, and aerobic capacity or cardiovascular endurance.
Aerobic capacity, body composition, muscular strength, endurance, and flexibility. What is body composition? Body composition describes what part of total body weight is fat and what part is fat-free. Muscular strength is the maximal force your muscles can exert in a single effort. Muscular endurance is the ability to sustain or repeat muscular activity over time. Aerobic capacity is the body's ability to take in, transport, and convert oxygen to energy during exercise. Flexibility describes the range of motion of muscles at the joint.
The following are the goals of physical fitness test: to determine the level of fitness, to identify strengths and area of development or improvement, to identify the basis for physical activities, to gather and analyze data for norms and standard setting, and to modify and guide pupil or students. What are the different barriers to physical activity? Some common explanations or barriers that people cite for resistance to exercise are insufficient time to exercise, inconvenience to exercise, lack of self-motivation, non-enjoyment, boredom of exercise, lack of confidence in their ability to be physical, active, or low self-efficacy, fear of being injured or having been injured recently, lack of self-management skills such as the ability to set personal goals, monitor progress, or reward progress towards such goals, lack of encouragement, support, or companionship from family and friends. The following slides discuss the safety and measures before doing the physical fitness test. Before doing any kind of physical activity or physical fitness test, observe the following. The testing area should be free from any obstructions. Students with certain illness or not in good health condition are not advised to take the test. Avoid heavy meals before taking the test. Should have a proper warm-up exercises before taking the test. You should also wear proper PE or sports attire. Remove any body accessories to prevent injury. Take the resting pulse rate before the test starts. It should be less than 120 beats per minute. The test that requires cardiovascular endurance and other tests that involve same group of muscles should not be taken in succession. Physical fitness testing is always an important component of physical education. This will help an individual know one's strengths and weaknesses. The following slides are the self-testing activities of health-related fitness. Anthropometric measurements. Purpose: to measure body composition. Equipment needed: weighing scale and tape measure. If you don't have any weighing scale at home, you may seek assistance with your nearest barangay health center to get your weight. Procedures: in getting your height, stand with trunk straight. Measure the distance from the floor to the top of the forehead. Record the score in meters. For your weight, stand on the weighing scale, free from any object, for weight accuracy. Record in kilogram. Waistline. Locate your upper hip bone. Find the proper spot by placing your hands around your waist, squeezing slightly, and then moving your fingers downward until you feel the top curve of your hips. Place a tape measure around your bare stomach just above the hip bone. Record in centimeter. Hip line. Place the tape measure in the widest part of hip in line with the pubis. For the competitions, here are the formula for the BMI and waist to hip ratio. Body mass index or BMI. It is a measure of body based on height and weight that aid in determining weight categories. BMI is equals to weight in kilogram divided by height in meters squared. For the waist to hip ratio, it is the measure that store body fats percentage by the relative measurement of waist and hips. WHR is equals to waist circumference in centimeter divided by hip circumference. Body composition is the body's relative amount of fat to fat-free mass. How to get the body mass index or BMI? You should get your weight and height in kilogram and meter. So after computing your body mass index, these are the classification for your BMI. Flexibility. It refers to the ability of the joints to move through a full range of motion. Example activities in flexibility are sit and reach and zipper test. Zipper test. The purpose is to test the flexibility of the shoulder girdle. Equipment needed: tape measure or ruler. For your scoring, record the zipper test to the nearest 0.1 centimeter, following the scoreboard.
Flexibility is the ability of the joints and muscles to move through the full range of motion. We have the first test, zipper test. Purpose: to test the flexibility of the shoulder girdle. Equipment: ruler. Procedure for the tester: A. Stand erect. B. Raise your right arm, bend your elbow, and reach down across your back as far as possible To test the right shoulder, extend your left arm down and behind your back. Bend your elbow up across your back and try to reach or cross your fingers over those of your right hand as if to pull a zipper or scratch between the shoulder blades. C. To test the left shoulder, repeat procedures A and B with the left hand over the left shoulder. Procedure for the partner. A. Observe whether the fingers touched or overlapped each other. If not, measure the gap between the middle fingers of both hands. B. Record the distance in centimeter. Scoring. Record zipper test to the nearest 0.1 centimeter.
Sit and reach. Purpose: to test the flexibility of the lower extremities, particularly the trunk. Equipment needed: tape measure or meter stick. For your scoring, record the farthest distance between the two trials to the nearest 0.1 centimeters, following the scoreboard.
Sit and reach. Purpose: to test the flexibility of the lower extremities, particularly the trunk. Equipment: tape measure or meter stick. Procedure for the tester. A. Sit on the floor with back, head, and shoulders flat on the wall. Feet are 12 inches apart. B. Interlock thumbs and position the tip of the fingers on the floor without bending the elbows. C. After the partner has positioned the 0 point of the tape measure or meter stick at the top of the middle fingers, the tester starts the test by sliding the hand slowly forward without jerking, trying to reach the farthest distance possible without bending the knees. D. Bouncing or jerking movement is not allowed. E. Do it twice. Procedure for the partner. A. As the tester assumes the B procedure, position the 0 point of the tape measure at the tip of the middle fingers of the tester. B. See to it that the knees are not bent as the performer slides the farthest distance that he could. C. Record the farthest distance reached in centimeters.
Cardiovascular endurance is the ability of the heart, lungs, and blood vessels to deliver oxygen to working muscles and tissues, as well as the ability of those muscles and tissues to utilize the oxygen. Endurance may also refer to the ability of the muscle to do repeated work without fatigue. Example activity is the 3-minute step test. 3-minute step test is to measure the cardiovascular endurance. The height of the step you needed is 12 inches. Equipment is stopwatch or cell phone with stopwatch. Scoring, record the 60-second heart rate after the activity or the beats per minute.
Cardiovascular endurance. It is the ability of the heart, lungs, and blood vessels to deliver oxygen to working muscles and tissues, as well as the ability of those muscles and tissues to utilize the oxygen. Endurance may also refer to the ability of the muscle to do repeated work without fatigue. The next test is a 3-minute step test. Purpose: to measure cardiovascular endurance. Equipment: 1. We have the step, and get the height of the step, 8 inches for elementary and 12 inches for secondary. 2. Stopwatch. 3. Drum, clapper, clicker, metronome with speaker or any similar device. Procedure for the tester: A. Stand at least 1 foot away from the step or bench with trunk erect and eyes looking straight ahead. B. The first step of the sequence should be alternate. At the signal go, step up and down the step or bench for 3 minutes at a rate of 96 beats per minute. One step consists of 4 beats. Up with the left foot, count 1. Up with the right foot, count 2. Down with the left foot, count 3. Down with the right foot, count 4 for the first sequence. Then, up with the right foot, count 1. Up with the left foot, count 2. Down with the right foot, count 3. Down with the left foot, count 4 for the second sequence. Observe proper breathing. Inhale through the nose and exhale through the mouth. C. Immediately after the exercise, stand and locate your pulse, and in 5 seconds or at a signal, start to get the heart rate. D. Don't talk while taking the pulse beat. E. Count the pulse beat for 10 seconds and multiply it by 6. Procedure for the partner: A. As the student assumes the position in front of the step, signal ready and go. Start the stopwatch for the 3-minute step test. B. After the test, allow performer to locate his or her pulse in 5 seconds. C. Give the signal to count the pulse beat. D. Let the performer count his or her pulse beat for 10 seconds and multiply it by 6. Scoring: record the 60-second heart rate after the activity.
Muscular strength is the ability of the muscle to generate force against physical objects. Example activity: push-up, curl-up, and basic plank. Push-ups is to measure the strength of upper extremities. Equipment needed: any clean exercise mat. The goal is to perform a proper push-up. Look at the picture on the screen, and this is the proper push-up for boys, and the proper push-up for girls.
Push up. The purpose of this test is to measure the strength of upper extremities. To do this, we need a mat. To do push-up, first, lie down on the mat, face down in a standard push-up position. Palms on the mat about shoulder width, fingers pointing forward, and legs straight, parallel, and slightly apart with the toes supporting the feet. For boys, straighten the arms, keeping the back and knees straight, then lower the arms until there is a 90-degree angle at the elbows. And for girls, with the knees in contact with the floor, straighten the arms, keeping the back straight, then lower the arms until there is a 90-degree angle at the elbows. Perform as many repetitions as possible, maintaining a cadence of 20 push-ups per minute. A maximum of 50 push-ups for boys and 25 push-ups for girls. For the facilitator, stand in front of the performer and look closely to the elbows to accurately judge the 90 degrees bend. As the performer assumes the position of push-up, start counting as the performer lowers his or her body until he or she reaches 90-degree angle at the elbow. Make sure that the performer executes push-up in the correct form. The test is terminated when the performer can no longer execute push-ups in the correct form, is in pain, voluntary stops, or cadence is broken. After the test, record the number of push-ups made.
Following the scoreboard, record the number of push-ups made, as well as the interpretation. Basic plank is to measure strength and stability of the core muscles. Equipment needed is any clean mat and stopwatch. For your scoring, record the time in the nearest seconds per minute, maximum of 90 seconds for boys and girls, following the scoreboard.
Basic plank. The purpose of this test is to measure the strength of our core muscle. To do this, we need a mat and stopwatch. To do basic plank, first, assume a push-up position. Rest body on forearms with palms and fingers flat on the floor. Elbows are aligned with the shoulders. Legs are straight with ankles, knees, and thighs touching together. Support weight on forearms and toes. Make sure that your back is flat. Head, neck, and spine are in a straight line. Keep abdominal muscle engaged and contracted. Do not let stomach drop or allow hips to rise. For the facilitator, ensure the availability of a mat or smooth flooring or anything that can protect the forearms. Give the signal go and start the time. Make sure that the back of the head, neck, spine, and ankles are in a straight line. Give 2 warnings. Stop the time when the performer can no longer hold the required position, or when the performer has held the position for at least 90 seconds. Holding the plank position beyond 90 seconds is considered unnecessary. After the test, record the time in the nearest seconds or minute. Maximum of 90 seconds for boys and girls.